Hi, I'm Nick Wilson. I'm an anaesthetic and intensive care clinician based here in Edinburgh, and I'm a PhD candidate at the University of Edinburgh, the principal investigator of this NHS Assure and Napier funded study called Quantifying Exhaled Aerosolized Respiratory Virus in Acutely Hospitalised Patients. The aim of this project is to build a sampling system, a new type of sampling system which will capture all of the exhaled breath that comes out of infected patients within hospital, or also subjects within the community, so we can understand disease transmission better. And this sampling system is unique in the sense it will collect all of the particles that come out in our breath, but it will size separate them into the larger particles and the smaller particles, and actually a few different levels within that, different sizes. This allows us to see in the different sized particles where is the infectious virus, and that can help us understand what kind of precautions and protections you need. If you think back to the start of COVID, there was a lot of confusion about how we should protect ourselves from transmission, with the initial emphasis being on hand washing and surface cleaning. As the pandemic progressed, it became clear that environmental ventilation and masking was progressively important. Our study aims to fill big evidence gaps in that entire area, particularly with regard to patients in hospital. In patients in hospital, a lot of emphasis of risk has been placed on medical procedures. This is based on very poor quality evidence and has since been shown not to be the case, but it's left a bit of a gap in our understanding of what patients present true and meaningful risk within hospital, both to other patients around them and also healthcare workers. So one of the exciting things about this project is the collaboration between engineers, virologists and clinicians in anaesthesia, intensive care, respiratory medicine, infectious disease, all working together with different areas of expertise to build the sampler, but also to design the clinical studies to help us answer the research question. So we hope that this study could revolutionize our understanding of respiratory pathogen transmission, emphasizing the importance of the small particles as places where the live infectious pathogen is located, and therefore change how we protect ourselves both within the community and the hospital, specifically looking to improve the distribution of environmental ventilation. Currently in hospitals, environmental ventilation is very directed towards medical procedures, whereas patients who are coughing and deep breathing with respiratory infection do not get the same level of ventilation. So we think our study could lead to a change in that. Working with NHS Assure and Napier has been a rewarding process that has benefited the study. The peer review process has added significant benefit to our study, and they have been very supportive and collaborative, flexible on our journey so far.